region. So I'm going to talk more about that as we go along here. Please let me know on YouTube if you can hear me okay, because we've had some issues with sound in the past. And I think we're good to go. All right, so my name is Dr. Cary Yurkiw. I'm a chiropractor here in Kelowna, and I own Tut Street Family Chiropractic. It's located on the corner of Tut and Raymer, and that is in Kelowna, a very convenient location. We have lots of parking in the area, and it's a nice, bright, and professional looking clinic. My journey to chiropractic started when I was a teenager, and what happened was I had a lot of knee pain when I was a teenager, and our family doctor told me it was just growing pains. And after years of suffering from the knee pain, my father took me to a chiropractor. He assessed my knees, he did some x-rays, he diagnosed the problem correctly and started treatment. And that treatment involved chiropractic care, but it also involved some therapy using kind of like a cylinder, like an MRI. And that was therapeutic to stimulate the healing process in my knees. And it really made a big difference for the way that my body functioned. It sped up the healing process. And it took about 6 months, and my knees were a lot better after that time. So that made a huge difference in my life. And at that point, I decided that I wanted to become a chiropractor. So here I am 30 years later. I went to the University of Winnipeg. Then I went to Toronto for chiropractic college. I returned to Winnipeg to practice for 15 years and then moved to the Okanagan 2008. I had a clinic in Penticton for 10 years, and I've been in Kelowna for 5 years now. And I'm very excited to share the information today about headaches and neck pain and how chiropractic can help. Also, I wanted to share with you what makes our clinic unique today. So how our clinic is different from other chiropractic clinics you may have been to, or if you're deciding to go to a chiropractor, how we're different. So let's first talk about headaches. So there's various types of headaches. Some of the headaches that people have are tension headaches, migraine headaches, cluster headaches, sinus headaches, and rebound headaches. So now you've probably heard of 2 or 3 of these, and maybe you've even experienced something like this. I know I have. I've had tension headaches before. I've also had migraine headaches as well. So tension headaches are described as the most common type of headache. They're characterized by a dull aching pain across the forehead, the temples, the back of the head or neck. And usually they're a result of stress or tension, tightness building up in this area. This can also lead to a sensitivity to sound and light, and it can cause mild to moderate pain in this area. Some other causes of tension headaches are muscle tension. So let's say there's imbalances in the muscle and the alignment in the neck area, poor posture, and even anxiety. Migraine headaches, these are intense throbbing headaches that can last for hours or even days and often affect one side of the head. The symptoms include severe pain, nausea, vomiting, sensitivity to light, sound, and sometimes smell with visual disturbances. So some people experience like an aura, like a flashing light, and this can lead to the migraine, the start of the migraine, and then intensifying after that. Some of the causes: genetic factors, hormonal changes, certain foods and drinks, stress, and sensory stimuli. Like sometimes a bright light can trigger a migraine. Cluster headaches, these are severe headaches that occur in cyclical patterns or clusters, often waking individuals from sleep. The symptoms are intense pain around one eye or another eye, one or the other eye, and red or watery eyes, nasal congestion, and restlessness. The cause is unknown, but it might involve the hypothalamus, which is a part of your brain, deep in your brain, seasonal changes, and genetic factors. The fourth type of headache we talked about, sinus headaches, are associated with sinus infections, sinusitis, causing pain and pressure in the sinus area. Symptoms can involve pain in the forehead, cheeks, eyes, nasal congestion, runny nose, and fever. And usually this is caused by allergies, sinus infections, inflammation of the sinuses. And there's a few sinuses in the skull cavity. Two of them are right here on either side of the nose. There's two on the top above the eyes as well, called the frontal sinuses right up here. There's some mastoid sinuses behind the ears right here as well. So they're all, there's a number of sinuses in the skull region, and if these get filled with fluid, it can cause a lot of pressure and a headache. The last type we talked about, the rebound headache, this can be caused by medication overuse, and this can lead to a cycle of frequent headaches. These can cause daily headaches, often starting early in the morning, varying in type and intensity, and this can be a result of overuse of certain medications like aspirin, acetaminophen, triptans, and can cause different types of headache symptoms. So those are the 5. I've seen results here in the clinic, especially with tension headaches, migraine headaches, and sinus type of headaches. We haven't had a lot of cluster headaches, and rebound headaches are due to medications, so those are treated differently. Now, the causes of most headaches can be traced back to the factors we talked about just now, but can also be a result of other types of causes like pinched nerves. And when someone has a pinched nerve, especially in the neck region, in the upper part of the neck, this can cause a headache. So I've seen a lot of people with a pinched nerve in the neck area, and that can cause pain that radiates up from the upper part of your neck, going around the top of the head above the eyes. And this is the greater occipital nerve that's affected, coming from the back of the skull and the upper part of your neck. There's another nerve, the lesser occipital nerve. It kind of goes around the ear to the temple. So that's another possibility for a cause of a headache, is when the nerves get pinched. And I'm going to show you right here on YouTube what that looks like. So let's see if I can get this slide up for you guys and just show you. Okay, no, I can't get that slide up. Sorry guys, I was testing this before we started, but I can't get that slide of the anatomy of the neck up. Okay, so pinched nerves can cause headaches. Neck misalignments, especially at C1 and C2, the top 2 vertebrae in the neck, can cause headaches. Stress, we talked about that. Dehydration is another one. So sometimes when people are dehydrated and their body lacks fluids, that can cause a headache. So drinking enough fluid, especially in the summer, or if you're in a dry climate, very important. As well as taking in some salts or electrolytes, that's important too. That's something I like to talk about here in the clinic and recommend to people. So all very important, as well as your posture. And posture, you know, when you're slouching or your neck's kinked off to one side, this can cause headaches as well, because it can put pressure on a certain area. It can affect the blood flow going through that area, as well as the nerve flow. So very important. And that's something chiropractic is very good at treating, is pinched nerves, misalignments, and poor posture. Now for facial pain and TMJ, this year we've seen quite a few people with TMJ and facial pain. And this involves the jaw joint, or what we call the TMJ joint right here. And when the TMJ joint is affected, it affects the opening and closing of the jaw. It can affect one side or the other, so you can get a jaw that doesn't open properly, maybe off to one side or the other. And this can cause pain and discomfort on one side versus the other. So very important that we check the alignment of the jaw, and if there's any misalignments, we do the proper adjustments to realign the jaw joint, as well as the way the jaw functions. Also the pinched nerves in the area. If there's a nerve that's pinched in the jaw area going down into the face, that can cause some facial pain. Also, it can radiate up into the temple region and even into the teeth. So we want to check the nerves that are traveling through the head region by the jaw, coming from the neck up here in the upper part of the cervical spine. Also the muscles. There's a number of muscles like the masseter muscle in the jaw region. You do have some scalene muscles in the front part of the neck. You've got big muscles like the sternocleidomastoid on the side of the neck. You've got the muscles in the back part along the spine. All very important muscles, because if there's muscular imbalances, you can get referred pain from those muscles or in the myotomal regions. That's what we call a referred pain from a muscle, is a myotome. And then the sinuses. Of course, we want to check the sinuses. Sometimes what I'll do for sinuses that are congested are craniosacral therapy. So craniosacral therapy is like gentle pressure in these areas to release the tension in the sinuses. Also, adjustments to the neck will help the lymphatic drainage from the head down through the neck into the chest. So this can really help to drain the fluids to speed up the process of getting you back to the way you should be. So yeah, we talked about these nerves right here. This slide shows the different nerves coming from the jaw region up into the temple, into the face, and some of the nerves that kind of come back up through areas here in the upper part of the neck. Now, for diagnosis and evaluation, it's very important that you see a health professional for that. And as a chiropractor, we see misalignments, poor posture, restricted range of motion in the neck all the time on a daily basis. So for a headache, facial pain, we want to check these areas. We want to check the jaw function and see where the pain is coming from. We'll use standard diagnostic methods like ranges of motion, posture, orthopedic, neurological tests to determine where the pain's coming from. And then we also want to make sure we have a complete history from the patient, because this can lead us to the right diagnosis, kind of like clues to tell us, well, where could this be coming from? What is the history like? Has there been trauma to these areas? Has the person had head or neck injury? Has there been a concussion? Has there been hit to the jaw or traumatic injury to the jaw? So all of these factors are very important for us to determine the mechanism of injury so we can properly treat it. Now, how can the chiropractic adjustments alleviate headache pain? Well, one of the ways is we do adjustments is just hands-on, like in this picture right here on our slide. So hands-on adjustments when the patient's lying face up, just gently turning the head, making an adjustment can relieve the pressure instantly. And these adjustments are done by hand. Sometimes there's a pop or a crack when we do that. And generally people feel really good right after that adjustment. So sometimes people are nervous. Like I had a few new patients this week and last week. Some of them have never been to a chiropractor and they want to know if it's going to hurt. And what I like to tell them is the adjustments actually feel quite good when we do them. So no need to worry about an adjustment and it hurting. It actually feels good after it's performed. As far as specific techniques that we use hands-on adjustments. We use instruments to do adjustments like the activator or the integrator. We use the Y-strap to decompress the spine. And sometimes we use things like craniosacral therapy that can be very effective with the skull bones and the sutures. For TMJ disorders, which is the jaw pain, what we like to do is we like to assess the opening and closing of the jaw, side-to-side movement, the disc inside the TMJ joint. Sometimes that causes clicking. And then what we do is adjustments to the jaw. And some of those adjustments are done hands-on. So I'll actually do the adjustment by hand. Sometimes it's using an instrument to adjust the jaw to improve the range of motion. And sometimes we'll refer to dentists or surgeons that can help in the process of realigning the jaw giving a splint, those types of things to help with the treatment if it's more complicated. Now, lifestyle changes for pain management. What can you do lifestyle-wise to improve your condition? Here's a few tips for you. So, what changes to your lifestyle entail is eating habits. That would be one. So, eating a better diet and one that eliminates any type of stimulation that can trigger a headache. So, sometimes people are allergic to certain ingredients. Let's use MSG as an example. Some people have allergies to MSG, so eliminating MSG in your food can be very important if they trigger headaches. Other things like posture, having the right desktop setup, having the right standing posture, or if you're lifting objects, having the right lifting posture, playing sports, all very important because sometimes when these activities aren't done correctly, it can lead to misalignments in the neck, tension to develop, and then poor blood flow or nerve flow. And then stress management techniques. What I mean by that is if there's certain things that are causing you stress, addressing those issues, but also having techniques to deal with the stress. Some of those techniques can be breathing techniques, meditation, getting enough rest, proper sleep, quality of sleep, all very important to help with your lifestyle changes that can definitely lead to a reduction of the symptoms or even eliminating the headaches long term. My mother, it's a good story, good time to tell this story. She suffered, I can remember as a teenager coming home from school, and my mom would be in the living room with the blinds drawn and sitting in a rocking chair and kind of like hunched over, holding her head. And she had a migraine. And I saw this for years as a teenager when my mom did have migraines. And then when I graduated from college, I started working on Portage Avenue in Winnipeg at our clinic, Yurkiw Chiropractic. And my mom was the first receptionist, so she came to work for me. And I offered her chiropractic care, and she started to get adjustments on a regular basis. And years later, I asked my mom, do you still get the migraines? And she said, no, I haven't had them for a long time. And I said, well, when did they stop? She goes, actually, when I started working for you, that's when the migraines stopped. So the chiropractic care made a big difference in her life to stop the migraines. It came from her neck. She had a clothesline. We had an outdoor clothesline in the backyard, and she said, when I was little, I don't remember this, but you would pull a string and the clothesline would go up, and it would catch as a brake, but it didn't catch properly. The bar came down, it landed right on her head and compressed her neck, and that's when the headache started. So it was definitely a traumatic injury to the upper part of the neck. Chiropractic care decompressed that area, realigned it, and that solved the migraine headaches for my mom. Now, what else can you do? Here's some additional pain relief strategies for you. There's products we carry in the clinic that can help with pain relief. Some of those products are right behind me here, and this can help relieve the pain. It can help with different conditions. Like supplements can be very beneficial. And one of the supplements I like to give here in the clinic is magnesium. Magnesium that we carry as a powder. You mix it in with some water. It really helps to relax the muscles, but it also can really help to relax your body so you have a better sleep. And so magnesium would be a good supplement, or electrolytes like we were talking about earlier. Ice can be beneficial, especially if there's a lot of swelling in the area. If you had some trauma, injury, recurring injury, ice is very good. Or heat. Heat, if there's tension, a lot of muscular spasm, heat can really soften the tissues, promote better blood flow, increase metabolism. And heat also makes it easier for us to do adjustments because when the patient heats the area and comes in, it's a lot more flexible, easier to work with. So those are some of the things that I recommend here in the clinic. A proper pillow being another one, proper chair like the one I have here that I'm sitting on to support your back if you're sitting at a desk a lot, or even some traction wedges and traction for your neck, like that product right there, can really help to take the pressure off certain nerves in the neck area. Now, there's a number of reviews we've received over the years from patients that we've treated for headaches, jaw pain, facial pain, what we're talking about today. And I'm going to switch slides here. Hopefully this is going to work. I'm going to switch slides and just go over to the window on our reviews. And here it is. And most people leave reviews for us here on RateMDs. I have a profile for Kelowna. I've been here in Kelowna for about 5 years, so I had to start a new profile because my previous profile was in Penticton when I was there for 10 years. But these are the reviews we're getting more recently. You can read these reviews and how chiropractic has helped people, and especially with headaches, jaw pain. Here's one right here on the jaw. Dr. Cary is one of the most exceptional doctors I've ever met. His expertise and personalized approach to addressing my TMJ pain were truly impressive. His clear explanations and gentle adjustments brought significant relief just after a few sessions. I highly recommend Dr. Cary for anyone seeking effective chiropractic care. I remember this patient. Of course, I'm going to protect his confidentiality, but it was funny because my father-in-law likes these drinks. They're called Rusty Nails, and it involves 2 parts of scotch to 1 part Drambuie. And I had run out of Drambuie, so I went to the liquor store to get the Drambuie because he was coming over for dinner. When I went in, I asked the staff person behind the desk, do you have any Drambuie? Could you show me where it is? And he pointed it out. I went to buy it. And then when I bought it, he said, hey, I've seen you before. You're on social media. You're a chiropractor. I said, yeah. He goes, can you guys do anything for jaw pain? I said, yes, we can. It depends on what's causing it, but here's my card. And then shortly after, a few days later, this patient booked in, came to our clinic. He's now moved on to another city, but this was the result of that interaction and treating him for jaw pain that he suffered with for a long time. Pain in the jaw, clicking in the jaw, and it was hard to chew because his jaw would shift and it was hard to bite down. So that's an example there of TMJ. There's a number of other examples, and you can go to our Google profile as well. Click right here and you can see the ratings that we've received, as well as the people who have left reviews for us for a number of different conditions. So those are the reviews we have online, and just going to go back to our slides here. Okay, here we go. So now I'm going to advance our slide. Let's go to the next one here. If you guys have any questions at this point, please feel free to ask. The way you can ask on Instagram, just type in the comments. I will keep an eye on that. If you're shy, you don't want to type a question in the comments, you can always DM me later or type later in the comments and we will check our social media. If you're here on YouTube, feel free to type in the chat, and I am watching the chat here, so type your question here and I'd be happy to answer that question for you. Today we were talking about headaches. We were talking about different types of headaches. We were talking about jaw pain or TMJ. We were also talking about facial pain and the different nerves in the face, cranial nerve number 5 and 7, which is the trigeminal and the facial nerve. We were talking about the greater occipital nerve in the back part of the skull going around the top, coming from the upper part of the neck. We also talked about the lesser occipital nerve, the nerve that comes out of this area here. C1 and C2 goes around to the temple and the ear. We talked about blood flow. Maybe we didn't talk about blood flow enough today, but one thing I'll point out is when you do have misalignments, and I wish my anatomy slides would advance because I was having trouble advancing those slides, but when you have misalignments in the upper part of your neck, there's arteries and veins going through the neck area. And for arteries, you've got the carotid arteries in the front part of the neck. Then you've got the vertebral arteries in the back part running right through the vertebrae. Of course, when you have misalignments in the vertebrae are shifted, they're twisted, it's going to cause interruption of the blood flow. And most of that's going to be backing up of the venous blood flow, the circulation in the veins, as well as your lymphatics. But it can't be good for the arterial blood flow either if you have misalignments, because then the artery has to go through a circuitous path to get to the brain. So I think adjustments also help the blood flow, the circulation from the heart to the brain and back through. It has to, because you need the right structure or anatomy for that blood flow. So there's the vascular component or blood flow component to headaches as well. So that's very important as well. So if there's no questions, I'm going to advance to the next slide, and that is our limited time offer for new people. Now, if you're in Kelowna, we are accepting new patients. You don't need a doctor referral to come and see us. And you can book online. I'll show you that in a minute. Or you can call or message us here at the clinic as well. And we do have same and next day appointments available. We're open 7 days a week, so it's very convenient, including holidays. And we do bill directly to insurance, including ICBC, if you've been in a car accident. So in BC, no fault for car accidents, meaning everybody in the car or both cars that were involved, or multiple cars, are covered. No matter whose fault it was, everybody has or will get a claim number, and you're allowed 25 visits in 12 weeks of care here in the clinic. But we do bill directly to 25 different insurance companies like Canada Life, Sun Life, Manulife, all of these major insurance companies, and some of the lesser known insurance companies too. We can bill directly to them through portals like TELUS Health. So we do bill directly to insurance. That's another benefit of coming to see us. Again, no doctor referrals needed, and we are accepting new patients here at Tut Street Family Chiropractic. Now, I'm just going to show you guys how to go about booking an appointment if you're interested in doing that. If you don't live in the Kelowna area, then you can always reach out to me. You can message me here or send me a DM, and I'll try and find a chiropractor in your area. I've done that for many people in Toronto, Saskatchewan, Vancouver, Victoria, the US, Palm Springs, LA, places like that. So I'll find a chiropractor for you that does a similar technique to what we were talking about today. Just going to close this window. I'll open this one on YouTube. This is our website. Now on Instagram, you can click on the link in the bio, and that will take you to our website. Here on YouTube, you can see our website. And if you're here, you just have to click on this button right here that says book now. And that will take you over to this screen where you can click on the initial visit. You can add that visit. You can then look for a day and time for an appointment right here. And then you can book an appointment. Usually we have one appointment available for new patients on a daily basis. So I've asked my staff to keep one spot open. We know there's a lot of emergencies and there's people in urgent need to come in. So we keep one appointment each day open, at least one appointment open for new clients. So that's how you book an appointment. And if you guys don't have any other questions, it's been a pleasure having you today here with me doing this webinar. It's one of my more favorite things to do is to teach people about their health. And webinars are great because we definitely get to highlight different treatment methods in the clinic, as well as we get to talk about different conditions, this one being a very popular one, very important one. So I want to thank you for joining me today. If you want to get tickets for the upcoming webinars, most of them are free. You can go to our Eventbrite page and you can get a ticket for the next event. You can always go to our website as well, to the events tab on our website, and you can get a ticket there. And I